Culture.
All right, let's bring on Victor Wutor. And before he says his first words, please permit me to tell you who he is, because if I ask him to, he'll probably not say all these things. But I am going to tell you who my beloved friend is. All right. Now, Victor is a PhD. He holds a PhD in biotechnology. He's a doctor of public health, has an MBA in entrepreneurial management, an MSc in applied microbiology, Bachelor of Pharmacy, certified respiratory educator, a practicing pharmacist, clinical professor at the University of Alberta, Canada, a fellow of the Ghana College of Pharmacists, senior consultant at AE Consults, Lethbridge, and for today's discussion, most importantly, the founder and board chair of Asthma Ghana. How?
Radio culture.
We will have that discussion on a personality interview. But today we're here to speak about asthma. My friend, my brother, how are you today? Welcome to the show.
Thank you very much. I hope you can hear me loud and clear.
I can hear you loud and clear, and I can also see you. Thank you very much for making time.
Excellent. Thank you so very much for having me on the show. And I want to use the opportunity to say hello to your listeners. And then, here to share ideas, learn from each other. And then, we get better. We can be of use to humanity. Thank you very much.
Very much. Thank you, Sly. And let me start by asking you a statement that I made, which to me is hypothetical because it's not researched. You are the expert. Help us understand this, if what I said is accurate. I think that in Ghana, asthma is very much on a general level undiagnosed and unchecked. Some people don't even know they have it, but they suffer from the symptoms. Is this accurate?
Yeah, I agree with you to a very large extent. With Asthma Ghana, we have a patient support group of almost 400 people. And then some of the questions you get from people, you get to understand that, look, asthma is underdiagnosed and undertreated in Ghana. So what you said is absolutely true. Yeah.
Okay. What is asthma to start with? Some people know it's some type of respiratory condition, but there are different types of respiratory conditions, aren't there? What exactly is asthma?
So asthma is technically a chronic medical condition that affects your airwaves, and then it causes inflammation of your the airwaves, and the muscles become very tight. And some of the typical symptoms that we normally have the 4 cardinal symptoms of asthma. So to begin with, there's inflammation there's narrowing of your airwaves, and the typical symptoms, which are, like I said, the cardinal symptoms. You have coughing, which normally is worse at night and early mornings, and you have wheezing, and you have chest. You are chesty. You feel like your chest is so tight, kind of thing, and you have difficulty in breathing. That's gasping for breath. Those are the 4 typical symptoms that we see, and asthma affects virtually everybody from day 1 of birth till probably the last day. You can find asthma along the spectrum.
Why? So, okay. Why? This is a follow-up to something you said earlier. Why is asthma worse at night, or at least that symptom of coughing? Why is it worse at night and in the mornings? What accounts for that?
So you see, when there's inflammation in there, all right, the airwaves get narrow. Okay, and when you are active, the body is working, so a few things are happening throughout. But when you lie down, like in the comfort, nothing is happening there. Now we come to see that the cough, because it's the issue of the muscles. There's a problem with how the muscles are aligned when you are lying down and when you are awake. That is what kind of prompts that situation. And also there is a school of thought that we have what we call the circadian effect. These levels of some chemicals increase and decrease in the course of at the day, and when you sleep. Some believe that is what comes into play, but generally we see that commonly with especially children, the coughing is worse at night and also in the early mornings.
And then some of the symptoms that you described, those cardinal symptoms that you described, those are not peculiar to asthma, though. Other conditions share these symptoms. Is that not the case? And if that's the
That
case,
is true.
how do you tell the difference between whatever other condition that may be and asthma?
Well, that is true. There are several other conditions that will maybe the same kind of symptoms, all right? And then, so let's say that we know that if your mother has asthma, there's a high possibility of you having an asthma, all right? And we know that if you have asthma and you are given a medication, some kind of medication, we expect it to reverse the symptoms immediately. All right. But the best way to establish that someone has asthma is to have a test. I mean, with a spirometry test, which would tell you exactly that you have asthma or you don't have asthma. Or it may not be a borderline kind of thing, but your best bet in order to know whether you have asthma or not is to have the spirometry test, which could be done. And then, yes, it is there. I mean, another example is that if you have COPD, which is more, is common, especially who smoke, and it gets worse and worse and worse. There isn't much you can do about it. But with asthma, if you take the treatment, if you have an asthma attack, we give you treatment, and we expected that you should reverse the symptoms or you should get some improvement. But with COPD, over the years, it gets worse and worse and worse till your creator calls you.
Interesting. Which means in COPD, there's no reversal at all whatsoever. No known treatment can reverse COPD.
No, we make your life comfortable.
Asthma is actually reversible, or at least maintainable,
yes.
So to speak.
Yeah. I mean, even though asthma is a chronic medication that we know, a chronic medical condition, and then it could have a massive effects on your life. I mean, asthma under proper treatment, all right, it can be maintained to the point where you can live a normal life without any effects. If your asthma is under treatment, more often than not, we can treat it, right conditions and everything. You should be able to lead a normal life. As a kid, you should do what every child does, and an adult should do everything that's an adult does. Unlike in COPD, we just make your life comfortable, try to make you breathe well, try to make you live longer, kind of thing. But down the line, it's just going down. It doesn't get better.
Wow. No, before we continue, let's look at some. Okay, we've looked at the definition. Obviously, everything is in the these things that you said to us. Let's look at some statistics. How bad is asthma in Ghana? Is it something that we should spend nights, sleepless nights over?
Yes, I do believe that. I mean, statistically, there is a publication out there which tells that we have, on the average, about 12% of the population has asthma. Another publication tells me it goes to about 20-something%. So it varies. And the truth about it too is that, I mean, if you conduct a research in, let's say, Accra or Kumasi, chances are that you're going to have a higher percentage. And if you do that in my village, in the Volta region, or in the village somewhere, chances are going to be lower, because there's a variation in the asthma prevalence based on where the research is conducted. It's higher in the urban areas compared with the rural communities, and then also time of the year and a lot of things. So for me, I asthma 12, even if it's the 12%, which is the average, is still of concern to me. I mean, then it's something we cannot let go, because look, every life is precious for me. Every life is precious, and asthma death is something that should be preventable. So if we can prevent those 12 out of every 100 people who die, that is massive for the country. So for me, we need to do everything as possible to save lives.
Is it practical though?
Yes. I mean, look, I have. Let me tell you, the biggest challenge with asthma is the underdiagnosis, and even the treatment is a big challenge in our part of the world. And then we'll talk about one of the projects that we are doing with Asthma Ghana, where I'll draw your attention to something. The drugs are expensive, so people tend to use drugs which have massive and extreme side effects, because at the end of the day, they get some relief once they take the medication. But there are proper and medication that we know that if you use them consistently, you're going to have relief and you can go without asthma attack for a period of time. We know that's a fact. But if the drug is expensive, the person cannot afford to buy them, the health insurance is not supplying them, and definitely it's of concern.
All right. Let's watch this video really quickly. Courtesy Joy News. And I want you to react to some of the things in there. Let's watch.
Affecting millions globally silently. More than 250 million people live with the condition. Sadly, about 450,000 die annually. That's according to the World Health Organization. In Ghana, asthma accounts for up to 10% of all hospital admissions among children. That's more in the following report.
According to the World Health Organization, an estimated 250 million people across the globe are living with asthma, and around 455,000 people die from the condition every year. In Ghana, asthma is responsible for up to 10% of all hospital admissions among children, with thousands more affected by the disease, often exacerbated by poor air quality and limited access to inhalers. Dr. Juliana Oye Ame, Chief Executive Officer of the Trust Hospital, speaking at the commemoration of the World Asthma Day here in Accra, has called for urgent investment and policy reforms to address the critical shortage of asthma care in the country.
Asthma is not only a personal health concern, it is also a public health challenge, as research informs us that over 96% of asthma-related deaths occur in low and middle income countries, where access to essential life-saving inhalers is often limited or completely unavailable.
Currently, 1 in 3 asthma patients in Ghana is able to receive appropriate inhaled treatment, despite inhalers being the gold standard in asthma management. Dr. Oye Ame further emphasized that the lack of access to proper inhaled treatment is a national crisis, leaving many vulnerable, especially among children, as asthma remains a leading cause of hospital admissions and mortality.
According to data from the World Health Organization, asthma was responsible for 1,979 deaths in 2020, accounting for 1.13% of total mortality, with a death rate of 13.95 per 100,000 individuals. And these statistics extend beyond mere numbers. They signify the loss of mothers, fathers, children, and potentially our colleagues.
The global.
Okay, so Doc, let's look at these statistics so far. Does anything connect, or does anything?
Yeah,
is there somewhere?
The information is accurate there. I mean, the total. I don't know when those thing was. But she mentioned about 250 million globally. As we sit now, it's about 268 million now. All right.
Obviously, this is a little.
The numbers are very true, and no, we can't sit aloof. It's not acceptable any longer. And like I said, the biggest challenge we have is the diagnosis and the treatment. We talk about it. Ghana now, everybody's talking about effect of hard drugs, effect of galamsey and everything. But if you look at asthma is just one of the. I look at it as one of the low-hanging fruits that we should be able to tackle easily. We shouldn't let any. Go ahead.
So one of the things that was mentioned in that report, which I think also, to borrow your words, very low-hanging fruit, is the issue of air quality, right? In Ghana, we don't have too much government control over the quality of air we breathe. People burn tires, people burn rubbish in their backyards, people anyhow, as we say,
Yeah.
What's the connection between air quality and asthma? And what do you think the government should do to, clear this low-hanging fruit so we can worry about the higher fruit further down the road?
I tell you what, asthma, as we say, is that normally what we say is that we have trigger factors, things that precipitate asthma. All right. With some people, is some kind of food. With some people, is a dust. Some people with allergens. Some people with what they inhale, smoke, and all those things. So anything can be. Some people is just perfume. All right. Now we have different trigger factors for asthma. Now, when it comes to air quality, like I said, there is a huge discrepancy between prevalence of asthma in the urban areas compared with the rural areas. In the rural areas, I mean, the asthma prevalence is very low because the air quality is good. It's in the big cities like Accra, Kumasi, and that is where we have all those, I mean, so many vehicles with the carbon monoxide in the environment, the burning of tires, and I mean, using it. I mean, when you go to the butcheries and all those kind of things, all those things affect it. Look, we have laws against all those things, all right? But the fact of the matter, you and I know that Ghana, the laws are there, but we do not respect the laws. Now, the government has got to start doing something about some of those things. But for the meantime, whilst we're trying to make sure the laws are respected and applied properly, I think that we should make the drugs readily available. They should be affordable so people can use them instead of relying on herbal products and other things which do not work. All right. I mean, look.
Tell me something about that.
So technically speaking,
radio culture.
You saying herbal products don't work for asthma?
Let me be very straightforward here. I am a fan of herbal products, and I believe that it is an area that we have to research in thoroughly. Okay. Now, this is my challenge here. As we sit here today, there is no treatment for asthma. Now, I've received emails from several people who claim that they have medications that cure asthma in 1 month. It's a herbal product that you take it cures your asthma. Now, when you ask them, has it been tested? The answer is no, but we know that somebody used it and it worked. That is not scientific enough. All right. But we know, I mean, scientists, as we stand now, we know there's no treatment for asthma. But it's an area that we have to invest money to try and figure out if there are products out there that will actually work.
I see.
Now, let me tell you something. Let me tell you something straightforward. Yes. Now, when you take a herbal product for asthma, you could have, because look, whatever you are taking, you are inhaling, it contains an active ingredient. It is possible that the medication or the herbal product has some level of some of those active ingredients. So you are going to get some relief. However, in addition to that very good active ingredient, there could be 1,000 other things which could be damaging you, causing problems, which you wouldn't know. That's why I believe that as a country, we should spend money, research our herbal product because there is a lot of good in there.
I see. I think you've answered the question I was going to ask you just moments ago, which is that if let's agree that herbal products can't cure asthma, but can they at least control asthma? But I think you've answered that to a certain degree. But if you want to add that for me, please.
No, I think I have no doubt on my mind that some of those products can help give you relief from asthma attacks and also help relax the muscles and stuff like that. But we need a lot of research into that to establish the quantities that you need to use for an adult or a child. We need to establish all those things. Don't just tell me that I drink a cup of this and I should have relief. The same cup for my son or
one size fits all. Everybody drinks the same.
That is it.
You are very right on that. I think that's one of the areas that herbal medicine should definitely look into. But let me ask you. And again, you've covered the grounds on the causes, but did we explore everything? Because we did highlight air quality, right? And then you went on to highlight some other factors. Did we cover everything, or are there some other causes for asthma?
Oh no, I mean, so look, some of the causes we know. I mean, it's hereditary in some families. It runs through some families. There isn't so much can go. Yeah, it runs through some families, and the environment plays a fact in there. And like we all have trigger factors, and we also know that. I mean, there's some interesting relationship between people who have some medical conditions. Like if a child has eczema, all right, now. It is something that doctors have to start looking at for. There's a possibility of asthma popping up along the line. And we also know that asthma is very close related to people who have GERD, that's esophageal reflux, things like that. And one thing I also need to mention is that, look, we know that with asthma, between boys and girls, all right, before puberty, asthma is more prevalent in women. It's more prevalent in men, in the boys. So the boys complain more of asthma before we hit puberty. Once we hit puberty, the women take over. So the prevalence becomes more in women. So normally when you see the data, they show you it's more prevalent in women. Yes, we know that. But early ages, it's more prevalent in men. Latter part of our life on earth is more prevalent in the women. And it's also, we know that it has something to do with their hormones, estrogen along the line. So women who are asthmatic, they tend to have it tends to be precipitated a few days before they have their menses. So those are some of the things we need to look at. There's something I also want to say on personal level. We hear a lot of pregnant women refusing to take medication for the asthma treatment. I think that is something we need to let them know that, look, there are three things that could happen when you are pregnant, asthmatic gets pregnant. 1/3 of them could have the asthma could resolve or get better. 1/3 of them it will remain the same. 1/3 of them it could get worse. You never know where you will be. And it is better to get treatment than not to get treatment, because if you don't get treatment because you are scared of, you don't even know where you're going to fall. The implication on yourself and your unborn baby are very massive. So for me, it's a no-no. If you are asthmatic and you get pregnant, get your treatment. We know it works. There's a lot of them will tell me, no, I know that when I take some of those medication, it could affect my child. There's a publication out there which says that, some of the steroids that they use for asthma reduce the height of the children. Yes, it reduces the height of the children at the early stage, but when they grow, they catch up easily. But the question I have for you is, would you rather want your child to die from an asthmatic attack, or you would rather want him to be a little bit shorter? You can be still short and become the president of Ghana. It doesn't matter. Don't laugh.
No, seriously. And then short is relative also, right? Because
Exactly.
maybe we're going to be 6 feet, and now they're going to be 5 feet 8 or something.
Who cares? It doesn't really matter. But I'd rather want you to be alive than to let you probably something happens to you because I'm thinking about taking a drug that will protect you. No, don't do that.
All right. So Doc, tell us, when an attack happens, you've described some of the symptoms and all that, right? Which are some of the visible things that we see. But inside of the body, what's going on? Because I've heard that asthma actually kills people.
Oh yeah, definitely. It can kill. So if you look at the picture that I hope our viewers can see the picture there, right?
Yes.
No, in a normal situation, that is how your lung is supposed to be. It's open up. You can breathe in and breathe out. You're taking a lot of oxygen in. You breathe out the carbon dioxide. But when you have an attack, that is what is happening. So can you imagine how you'll be struggling to take in enough oxygen? And don't forget that this oxygen gets into your lungs. It gets absorbed into your blood vessels. It goes to nourish your brain. It has a lot to do. So technically speaking, if you have an asthma attack, it's not just the lungs that is suffering, but a lot of organs in your body will be suffering. Your brain could suffer as well. You could have a brain damage in a severe situation. All right. And you'll be gasping for breath, trying to catch your breath and all that kind of thing. So asthma attack is not fun. It shouldn't be. And we have to do everything possible to prevent it from asthma attack from happening.
Wow. And then what are some of the long-term effects? Somebody who lives, let's say somebody who's living, especially in a part of the world, let's use that example. Somebody, those in that section of our population who are living undiagnosed, right? But I remember growing up, there was this guy where we used to make fun of him. So that's what we used to say.
Exactly.
Apparently, it was funny for some people for some reason. Today, on hindsight, it's very bizarre, but we all used to make fun of this guy so because he was always like wheezing, but nobody even said asthma. It was just like so end of story. For somebody like that who lives long term with that condition, what is likely to happen?
So, at a point in time when you go undiagnosed for a while, it will get to a point where you end up in emergency one day. You get to the point where, look, so you've got something's going to happen to you, and somebody will tell you, take you to the hospital, and then you'll realize that, look, my friend, your lung is suffering. You can't even breathe. Then it becomes very difficult at that point in time to give you your quality of life back. All right. So can you imagine that your lungs narrow so much that you're only taking a small amount of oxygen? That's all you can do. Always wheezing, always gasping for breath. That is your quality of life. If it goes on for such a long time, then the muscles become used to that, so they adapt to that situation where that is how they behave. Sometimes when you put in any medication, they wouldn't even expand because that is how the muscles are used to. All right. So the earlier we diagnose that and put a patient on treatment, the better. And like I said, if you are on the right medication, the right doses and everything for medication, you should be able to lead a good quality life. You should do what every child does. You should play your sports. You should run. We have some athletes, high-end athletes who are asthmatic. It's doable. We have footballers who are asthmatics, but they are on treatment. That is what we need.
Let me ask you quickly. In Ghana, we call it Intishewa, at least among the Akan-speaking people. Meaning, say, friend Intishewa, I believe. Do you think traditionally we have any, apart from we're talking about herbal medicine, let's leave that to rest, but traditionally, without the intervention of Western medical knowledge and all of that, do you think traditionally we have any idea what Intishewa really is and how to handle it?
No, I tell you what, I think I follow that. I think they know. That is how they came up with all this herbal preparation, the herbal products that was giving them relief. Look, the truth of the matter is that, look, asthma has been here forever, and our forefathers were treating it in their own this thing. They were using some of those herbs to help them. And like I said, some of the herbs open up your airways for you to start breathing well. So for them, you have treatments. All right. So there's the herbal side of it. I mean, there's the spiritual side of it too, where the Sangoma will have to pray for you, or the bishop will have to pray for you. And, our society, right? I mean, everything.
And the whole psychology behind it.
The devil is there one way or the other. I have to take you to some shrine and pray for you, kind of. So yeah, I mean, definitely. Like I said, I believe that some of the products we use have some active ingredients there which will relax your airwaves, and you can breathe better than when you had an attack. But long term, I don't think it's the way forward.
And I think it's just a matter of researching, like you said, right? Because I mean, we may find some incredible, benefits from some of these herbs when we actually look deeper and regulate the doses and all of that properly. Let me ask you again. Does it affect boys and girls differently? Again, you've highlighted on some of that, but generally speaking, touch on that for me. Does it affect females and males differently?
Yes, it does. In that, when as adults, right, when any research you do, I did some work recently. Was it last year? I did some research on that. The prevalence. I was looking at a few things in asthma patients in Accra. The results was clear. More of the boys had asthma compared with the girls. It was more prevalent in boys than in girls. But we also know that as soon as they hit puberty, it reverses. We have more in females. So if you do any research in any environment and you compare your data, males and females, in adults, you have more females in there. So that is what happens. And like I said, we know that we believe strongly that hormones are implicated in there, and then especially estrogen is one of the hormones that we believe strongly is implicated in the precipitating asthma.
I see. So, two-pronged question. Does this mean that you can develop asthma later on in life, not from birth? And secondly, does estrogen in men also precipitate asthma?
Yes, you can. We have those who develop asthma later in life. And let me tell you something. So sometimes the person is already prone to it, but what is happening is that, I mean, they live in an environment where they don't get in touch with the trigger factors. Everything is fine there. All right. So you may assume that there's nothing there, but you may be asthmatic unknowingly. At a point in time,
low.
Exactly. When you come into contact with the trigger factors, then, oh, yes, there's something here.
I see.
Then a diagnosis, yes. It's also possible that if they had tried the diagnosis earlier in life, they could have found out that you have asthma. Because asthma, we have low grade, we have moderate, and have severe. So it depends on where you fall in that continuum. All right. And yes, I mean, if you the estrogen levels do also play a part in males, but with asthma, it's more testosterone. That's the big boy in there. So yeah.
Okay, now let's talk about the controversial You practice in a country that was one of the first to lead the way in this area. And you come from a country like me where cannabis is very, very much demonized.
Okay.
We are speaking to somebody who everybody should take seriously. This is why I took time to read your titles at the beginning of the show. So everybody will know that we are not conjecturing here. Now let's talk about cannabis and the relation to asthma. Growing up, we heard some of the people who had asthma, the one way of treating it was to smoke cannabis. Tell us, smoking cannabis or using cannabis, does it exacerbate the condition or does it help the condition? You are the expert. Tell us, please.
Let me tell you something here. One, when I have a lot of patients who are asthmatic and this is smoke, all right? Okay, I have a lot of patients who do that. Now, my advice is always this. When you have an attack or whatever, all right, and you smoke cannabis, now chances are that is going to make it worse. The reason being that, you see, when you smoke in there, those things could have become like trigger factors. Like the way dust could make your attack worse kind of thing. So it becomes a trigger factor. Now, my advice to them is always that if you want to use cannabis, and we believe strongly that there's a lot of publication out of which there's a strong correlation between cannabis and the anti-inflammatory property in the lungs. There is. Okay? Now, what I normally advise my patient, if you want to use it, your best bet is to go with the edibles, to go with the gummies, to go with those ones. All right, you will get. I mean, the cannabinoids. I mean, the CBD oils are there. The oils are there. Those kind of things. If you use those ones, which are not the inhalational, you stand a better chance of getting better results than in smoking it. All right. So that's my advice to my patients. But like I said, it's a fact. There's a publication out there which, I mean, links this into anti-inflammatory property in the lungs. But I always tell my friends and my patients in Ghana, it's illegal in Ghana. Stay away from it. If you find yourself in Canada where it's available, you can try your the oils, the edibles, the gummies, and all those other non-inhalable products.
So we're saying non-inhalable, but I've also seen some patients use, maybe not for asthma, but for other conditions. And so I'm asking if it's also applicable to asthma. But I've seen people use it in a form where they're not actually smoking it, but they kind of extract I don't know what to call it.
The active ingredient, the CBD or cannabinoids, yeah.
Kind of, but in a fume type of form, right? So it's not actual smoke. And I particularly saw this when a child that was using it. So of course they were not going to let the child smoke, right? So they extract that in some kind of form that where it becomes like some type of a nebulizer, right? Yes. But then the content is pure cannabis, whatever is in there. THC.
Yeah, definitely. You know, I mean, my brother, I mean, nebulizers work very well for asthma. So if you can nebulize your cannabinoids and we are sure about the amount that is getting in there, you should get some results with that. I don't have a problem with that at all. My only challenge is, I mean, if you are inhaling it, it could make it worse. But so if you're not inhaling, you have a nebulizer, you have the can going in there, we should be good. I should get some relief from that. But I always advise that. I always advise you need to talk to your physician or your healthcare professional about all this before you embark on that, because I mean, we need to make sure that there's not going to be any interaction between cannabis and whatever the gummies, the nebulizer, or whatever other medications you are taking. We need to look at that carefully, and you also be law abiding. Make sure that wherever you are, you do the right thing where the law accounts.
Exactly, because before the revolution came in, I call it a revolution, right? In the United States. I live in Texas where it's still not legal, but there are so many stores that you can just walk in and buy it. I don't even know how that works because technically speaking, it's not legal in Texas, but there's no cluster of stores that you will walk in and not find a cannabis store in my part of the United States. I don't know how all that happens, but anyhow, I agree with you. You have to check the local laws in your area to
Yes.
know how to do this. And I've seen people move to other states just so they can take advantage of the laws in that state, right? If you know, people would move to New York, for instance, or to, you know, Detroit City. And even in Detroit, I don't know about now, but it used to be legal in just Detroit and not the whole of Michigan. The law is all kind of ways, but you know, anyhow.
In my part of the world, it's easy. We just bomb into anywhere, whatever you want is there to buy and smoke and go away. Yeah.
And let me ask you again, just as a side issue right now, has Canada experienced any form of mental deterioration, medical deterioration, or social deterioration since it legalized cannabis?
I've read a publication which seems to point to the fact that it's becoming a problem along the line. I mean, and they always, at the end of the day, they will tell you that we need more research to prove it. So I mean, it's just like you do some research, and depending on your sample size and the group that you interviewed or you gather your data from, kind of thing, you could have your results going one way or the other. But like they always say, we need more, bigger sample size. We need a bigger this thing to do. You know what? I mean, look, every drug has side effects, and this are also drugs. I mean, so
Yeah.
if you're not using it appropriately, you're definitely going to have challenges. I mean, it's just
I'm
like even Tylenol,
Even
paracetamol,
water. Even water.
That is it.
I'm sure if you drink too much water, you have some kind of effect.
Definitely. Yeah. Mhm.
All right. Okay. Doc, let's zero in on some critical interventions. And this is what we're going to talk about. Asthma Ghana. Who is Asthma Ghana?
So Asthma Ghana is a charity. I mean, registered in Canada in Ghana. What we do is to help asthma patients, advocacy, looking at helping them with treatment, leading them to where they can have tests done. A lot of people don't even know where to go and do their tests. They don't even know what to do. And then we help them with all those things. And one special thing that we have done over the years, we pump in a lot of money, is that, look, let me tell you something. If you have a child who is asthmatic and you prescribe an inhaler for that child, or you have an elderly person and you prescribe an inhaler for them, all right? One important thing about inhalers is that you have to get a technique right. Mm-hmm. If you're using like Ventolin, the blue PAFA, which you all know, there should be a coordination between when you activate that PAFA and when you start breathing in, which is not possible for a lot of people. So we know that the way out of this is to provide them with what we call spacers or aero chambers. That is a spacer. So in that case, you just pump the drug into the space there and you just inhale it normally. So you don't have to coordinate when you actuate the medication and when you start breathing in. And this thing, I'm like, you get about 60% better results than if you are trying to inhale. Somebody is having an attack and you expect that person will be able to shake their inhaler and then breathe out and start pumping that medication in and breathing in slowly. It's not going to work. It doesn't work. So Asthma Ghana decided that we want to close that gap by providing patients with the aero chamber for free. So we imported thousands of them and then we distribute them across the whole country. I mean, I have some of my contact in the northern part of the country. We just ship them to them, any part of the country, and we send them to asthma clinics, we send them to hospitals, we send them to centers like pharmacies where they see a lot of asthma patients. We just send them to them, but we try to make sure that the people who actually need them get them. All right, so because it's a lot of money. I mean, one aero chamber could cost, like, up to about $27, $30 kind of thing. But we ordered tens of thousands of this and we are distributing them freely across the country. So that is one thing we are doing now. And then when they talk about one of the medications that we use for asthma treatment, that's the inhaled corticosteroid. These are very expensive, so a lot of people are not buying them. So the asthma gets worse because they can't afford to buy them. We believe that if we make these medications cheaper for them to use, we will control their asthma long term. They don't end up in the emergencies. They don't end up occupying the space there where somebody will, the physician will rather have to extend to help somebody. So we have done a lot of training for pharmacists in Ghana to help them, educate them on how to help their patients, make sure that they can maximize the treatment for asthma, and also to help their patients take them through. And one important thing that we normally don't see, in asthma treatment in Ghana is what we call the asthma action plan. Now, every asthma patient should have what we call an asthma action plan. And that is something that I do for my patients in Canada. But in Ghana, you hardly find that. Now, when I did the research last year, 80-something% of the patients did not even have anything. They didn't even know about asthma action plan. And the few which were done were provided by the specialists, not even the general practitioners or the pharmacists. That for me is a no-no. Every pharmacist who dispenses asthma medication to a patient should be able to provide an asthma action plan, which becomes a contract between the patient and the pharmacist and the physician, knowing what to do when your asthma is under control, knowing what to do when you experience exacerbation, knowing when to do when it's getting out of hand. So you have the green, yellow, and red light kind of thing, tells you stories about what to do about those things. So these are some of the things we are doing, and these are some of the things we are advocating for, that the cost of medication for treatment of asthma should be low so that people will buy the proper drugs for treatment instead of relying on treatment that have severe side effects down the line. There's a common drug in Ghana where, this Asthmadrine and salbutamol tablets. No, you have an asthma. You want to inhale a drug that goes straight to your lungs and take care of it. You go and take a tablet that goes into the system, it gets absorbed in your system, and by the time it gets into your lungs, all the side effects become prominent. All right. I don't believe that we should even allow this drug to be imported to the country, because the side effects it's just not acceptable. But unfortunately, if the person cannot afford to buy the right medication, would you let them not use anything at all? So that is the conundrum. But these are some of the things we do in Asthma Ghana, trying to help as much as we can.
So when you say the cost of asthma drugs should be lower, somebody has to pay for that. Are you advocating for the government to subsidize asthma drugs? Is that what you're saying?
See, let me tell you something. Look, we are importing most of those drugs into the country. All right. If I had a way out of this, we would get 1 or 2 companies in Ghana to manufacture them. All right. If they need support, we provide them with the support, we provide them with equipment, everything, so they produce it. And once we start producing this, the cost of it is going to go down. There's no two ways about that. All right. That is the area I'll look at strongly. And then, and the NHIS is also because, look, I can't blame them because it's an expensive drug kind of thing. And also think that some of the, I know my brother, some of the profit margins on some of those drugs are ridiculous, right? So there are a lot of things we can do as a people, helping each other, making sure that we hold each other's hand along the way. Unfortunately, we don't see that in our society.
Okay. And then Asthma Ghana, it's it's registered in Ghana and also in Canada. In Ghana, my understanding is that it's a group of, and you did mention that already, a group of people. Are these all doctors? Are they all pharmacists? Are they all who constitutes Asthma Ghana?
So Asthma Ghana, like I said, I have a patient support platform, and where we are nearly 400 there. And on that platform, I have physicians, we have pharmacists, we have nurses, we have asthma educators. We have, most of them are patients or parents of children who have asthma and all that kind of thing. We're all in there. You dump in your question there and you get an answer straight away. Now, when I started Asthma Ghana for the first 2-3 years, I had to wake up around 3:30, 4 a.m. every day, because the questions start coming around that when people wake up in Ghana, and it's 6-7 hours ahead of me. So for 2-3 years, I had to wake up. I had to be up by 4 a.m. every day to answer questions. All right. Now we have the numbers are growing. We have a lot of pharmacists and physicians showing interest. So people just go to that Asthma Ghana patient support group, throw in their question there, and they'll definitely get answers, kind of thing. So that's how we go about it and help. And we are hoping to start asthma clubs in schools now. And then I'm writing a book which is taking longer than I expected it to, for schools, where the responsibilities of parents, pay the students, the teachers, their headmasters, administrators, and everything. So it's going to be asthma book for our schools.
So you spoke about asthma action plan or something like that. Is that like something that's is it a device? Is it some notes? Is it a plan that you learn what to do when you get an attack and all that?
So yeah, so it's just like I call it it's a contract, all right. So we have it's a sheet of paper there. So we tell you that when your asthma is under control, this and this and this and this what you do. When you start having challenges breathing, the wheezing and whatever coming in. Now, if you're on this dose of medication, you increase the dose to this at this point, or you do this, or you call your pharmacist or call your asthma educator. When you get to the point where breathing becomes difficult, you can't catch your breath, nothing seems to be working kind of thing, they know what to do. So it's like you sign a contract with your pharmacist who normally will write sit down with you and go over the asthma action plan with you. Because on the asthma action plan, you know what your trigger factors are, what dose of the medication you are using, when to increase the dose, when to add a second dose, when to head to the emergency, when to call your family doctor, when to call your pharmacist. So that is what the asthma action plan is. And for me, virtually all my patients that I treat, I work with like in Canada, I make sure they have asthma action plans. But unfortunately, we don't do that here in Ghana, which I find unfortunate. So in all my teachings and all my encounters and training for healthcare professionals, and I always advise and say, look, it is very important. That could save a life, because your patient knows that when I'm using this thing to check my breathing and it's about 70% of my max, all right, I need to add a second drug, or I need to increase the dose of this medication. Those are very, very important. They may seem irrelevant, but those are vital things that could save lives down the line. So asthma action plan is just like a sheet of paper that your patient carries. The doctor has a copy, the pharmacist has a copy, and you could revisit it after probably a year, 6 months down the line, and then work on it, a few tweaks here and there.
Very interesting. And you donated these items. You've been doing it not just once. You've done it a few times. They're not cheap. How do you fund the operations? How do you do it?
Yeah, I tell you what,
$10 is a lot of money in Ghana, right? Yeah. For just one. And
so we ordered thousands of them. I tell you what, most of them is for money out of pocket. That is my passion. There isn't much you can do about it. I mean, one of the board of directors supported us some time ago, but this is continuous, all right? And like I said, that is my passion, and every life is precious. And somebody died because of asthma. I don't agree with. I don't think it's right in our community, in our society today. So I think that's my small contribution to that field.
Well, it's not small at all. But let me ask you, tell us about some of the operations in Ghana. Tell us about some of the beneficiaries. Tell us about where you've distributed some of these. What do you call them? Aero chambers, right?
Aero chambers or spacers, yes. And we have two types. We have two types. I mean, the ones for especially with the one you have there is normally adults can use them, all right. And there's another one that has that covers the nose kind of thing. Normally those ones are for babies and stuff. Yeah, and you know it has that covering that's for babies and the smaller ones. So you just cover your nose and your mouth and you just breathe in normally. And whilst you are breathing in, you are inhaling your drug and you get the results you want. I mean, can you imagine asking that child to just use the inhaler and then inhale it and coordinate when he actuates the drug and then inhales it? You're wasting it. Nothing's going to happen. And even when, I mean, even pharmacists, physicians, and nurses, the technique don't even get a technique right. And you expect somebody who is having a difficulty breathing is already shaking to do it right. No. So I believe that it's something that we are doing right. It's something that will have a long term. We've sent some of the air chambers to Kolebu Teaching Hospital, the pediatric unit. We sent to Tamale Teaching Hospital, Central Region, some pharmacies there, Tamale Hospital. We have Bolgatanga, I have some colleagues there. Tomorrow morning, I'm going to ship some 100 or 200 to the northern part of the country again. I mean, all over the country. I mean, once we get to know you need it, and we send it to you. We find a way to send it to you.
Are you monitoring though?
Yes, we do.
One thing, giving things out it's another thing making sure that those who really need them are getting them. Are you
Yeah, I
monitoring?
tell you what, most so the ones we sent like the teaching hospitals, I mean that's something we let the physicians do. And all my these things are not for sale kind of thing on them. I've had some people try to play games,
Charlie,
but
I
hey,
don't
this is
send
what
me
it
the
is.
name country you.
And copy.
This is
So
still
when
there.
we send it to the teaching hospitals, we leave them with the specialists there who, I mean, they see people who suffer. So they give it to those people. And most of the pharmacists and those
free,
I
as
mean,
you intended it to be.
exactly. They write names of the people who use them. Some of them take pictures of it to send to me. So, okay, we gave it to this person. That's their phone number. You can call to confirm, kind of thing. So those are some of the measures we put in place, even though it's tedious. And but I mean, those are some of the ways we can. So that's how we monitor the way some of those things go out.
I see. Well, we were for our audience, we were actually working with Doc at some point to go into the communities and give these things directly to some patients and all that. We're still working on that. I think it's something we will be doing.
Definitely, we'll be ever ready to partner with you and work with you, my brother.
Yes, by all means. Okay, so as we wrap up, are there any areas that we haven't touched that you think we should take a look at before we wrap up?
Yeah, I think some of we need some critical interventions in our part of the world. Okay, those are some of the things that I think that we should look at. Number one, I think that the drug should be readily available and affordable. Very important. Number two, we need education and public awareness. So patients know where to go, what to do. And we need to train our healthcare professionals to help the patients to maximize the effect of the drugs they are using. Mm-hmm. Our public healthcare system should include a lot of training and a lot of this medication readily available. And we need to also have guidelines which are readily available so that the guidelines should be there for everyone to know that this is what happens when you do that. And when you look at Mahama Care, this new policy, and which for me is one of the best healthcare policies since independence, taking care of chronic non-communicable diseases. You hardly hear anybody talk about asthma. They're talking about cancer, they're talking about kidney. Nobody talks about asthma. So that is something we are going to push ahead with. You have to start talking about asthma. Very important as well. All right, so those are some of the things we need to do as a people, and the asthma action plan for me is very important. We need to get people to, I mean, you finish school as a pharmacist, you should specialize. I mean, we need to encourage people to specialize in asthma, just like they specialize in diabetes and other areas. We need to get our physicians to specialize in respirology, just like every other people do in different parts of the world. So for me, these are some of the things we need to do as a people. And we should be ready to hold the hand of our people who are suffering and move them along instead of just thinking that we have arrived, to hell with them. No, it doesn't work like that. What affects me affects you. What affects somebody else affects all of us. We are one people and we need to be there for each other.
Fantastic. Before we go, I've received a few questions. I can't read all of them, guys, but I'll share a few before we go. What kind of name is this? sorry. My eyes. Okay. So the name is actually Rudolph. I don't know how I was reading anything else. Rudolph says I should ask you that, do you think some deaths have been caused by asthma but blamed on other conditions? What does that mean?
Yes, and yes.
I'm sure you understand what he means.
Yes.
People who may have died and it blamed on something else, but it was actually asthma. I think that's what he's trying to ask.
I agree with him.
Okay, so the answer to that is yes.
Yes.
Okay, all right. And then now
I'll give you a typical example. I'll give it
please,
somebody has asthma attack. Mm-hmm. Instead of taking him to the hospital, you take him to a prayer camp and they tell you it's the devil. The person, so we are blaming the devil. We are not actually blaming the cause of the distance on that. And somebody, we don't even know he has asthma, he dies, and they will start talking about, because of what it's. Look, asthma has killed a lot of people, but we did not blame it on the right cause of death. Yes, that's true.
And again, from what you said earlier, right? Somebody could have asthma, and then that could lead to another condition that may actually kill them, right?
Yes, that's true.
Yeah, if you
So
don't
let me
have
tell you
enough
something.
oxygen, yes.
Let me give you an example.
Mhm.
So you have asthma. I mean, it has been diagnosed. You're going around with very narrow lungs. You struggle to breathe in. You're not getting enough oxygen to your brain. What could happen to your brain when your brain doesn't have oxygen? Anything can happen. So that person will end up with the aneurysm, will end up with any cardiovascular problem, and will blame it on the cardiovascular part. What actually caused the problem is the fact that the asthma hasn't been treated. The asthma is not under treatment, and it implicates and gets something into the system.
All right. Now, Na says to ask you, if a pregnant woman, okay, so the question is, if a woman is pregnant, does the fetus in the tummy, I guess, in the womb, suffer from an asthmatic attack? If the woman is having an asthmatic attack and the woman is pregnant, does the fetus?
That is true. So let's look at it this way.
Mm-hmm.
So when you are pregnant and you are breathing normally, everything is fine. All right. You are providing oxygen gets in there, and your growing baby gets everything, all the nourishment and everything from you. Now, when you start gasping for breath, you are not taking enough oxygen. Your fetus is going to suffer as well. Because through the umbilical cord, you have everything going in there through there to the baby. So once you start struggling, you start having problems, your baby is also going to have problems. And that is why we say that when you are pregnant and you have asthma, you're an asthmatic who is pregnant, please, there are drugs that you can use, get treatment so that you are protecting yourself and your baby. So definitely, yes, your baby could suffer.
Okay, and I can only take one more question. So let's take this one from Caliber. Caliber, let's take yours. So Caliber says, of course, it's going to be about Canada.
Radio culture.
That's the sorry, so. Okay. Caliber says to ask you, sir, you didn't answer the question very well for him. He wants to know if cannabis helps or exacerbates asthma. If you have asthma, and then I think it's quite clear that you said don't smoke it, at least when you are having the attack. It's a bad idea to smoke it while you're having the attack. So Caliber, get that straight. But we're going to get Doc to still answer.
Okay, so Caliber, let me take my time to explain this. Now, if you have an asthma attack, it would be a bad idea to smoke cannabis. It'd be a bad idea because it could exacerbate it. However, if you do have asthma and you want to use cannabis, your best bet is to try the oils, the gummies, the edibles. All right.
How about teas? How about if you brew it and drink it as a tea? Would
that is fine as well. My only challenge with the inhalation, where you smoke it, that's my only challenge. Every other means, the nebulizing and all those, I have no problem with that. All right. Now, because there is some data out there, research which shows links the CBDs, the cannabis, to anti-inflammatory properties and we're in your lungs. So when you have asthma, what we see is that it's an inflammatory problem. So when you take any drug that can cause anti-inflammatory, open up your airways, then yes, it's something that can get you some relief. So I would say that from the data that's available now, yes, it will help you if you use it and use the right dose at the right time in the right environment, but it could also cause problems if you use it wrongly, the wrong type, and the wrong environment.
Especially if it's illegal in your part of the world. Thank you very much. Okay, now how do we join Asthma Ghana? Let's say we're listening to you right now. I have challenges with asthma. I want to join that network. How do I do so?
Well, it's just it's a WhatsApp group. If you go to our website www.asthmaghana.com, the phone number that the WhatsApp group that you can join, or I can make the phone number available for anybody who wants to join. You just send us a text message. We put you on there. You have any questions? You have people to help you, and so the phone number for Asthma Ghana is 054 682 9126. Let me just put in the chat box 054 682 9126. Yeah, that is the phone number to join our patient support group.
Okay, fantastic. All right. And then Bismarck says, very educative program. Doc, we thank you very, very, very much for such an enlightening discussion. We will be picking up with you again. This is not going to be the first time because I don't believe we exhausted all the questions. Today,
we didn't. We didn't.
Decided to introduce the activities of Asthma Ghana, right? Because again, and again, before we go, let me also ask you, are there any interventions to reach rural areas? Because, for instance, you gave the aerospace, machines to Kolebu Teaching Hospital or whichever hospital. That's people who are coming there, right? But there's somebody who is in my holy village of Gomajon who may be suffering from that, even undiagnosed. Is Asthma Ghana thinking of, and we already mentioned our, what we're planning with you and everything. But what I want to know is, if you live in an area like that, how do you benefit from your benevolence, for instance?
Okay, so what we do is that, look, if you went to a pharmacy and the pharmacist happens to be on our platform, they'll link you up with anybody. Sometimes they'll link you up to a physician who will do the diagnosis for you or have a chat with you over the phone and have a chat with you and arrange for you to get. And unfortunately, I probably shouldn't be saying this, but we've purchased medications for thousands of people across the country because they go there, the diagnosis has been done, they have the prescription, they can't afford it. They contact us, we do that. Look, we need to open our nets wider. That is the fact. And now it's more like a word of mouth kind of thing. But like I said, it's a lot of money, which we don't have. It's just from pockets doing that. And hopefully one day we get some sponsors and we can extend our services across the whole country and have to the point where we can even have a proper asthma clinics across the country for people to just go and get services at no cost or minimal charges here.
And then finally, in terms of government policy, you've touched on some of them, building, or facilitating factories in Ghana that will produce the medications and stuff like that. I can also think of maybe cutting down the taxes, right, on the medications, for instance, to lower the cost and all of that. But generally speaking, government policy, government intervention. We've been speaking about your private intervention. What should be government's intervention in this whole?
Look, and like I said, there's so much the government can do, and that's one of the things that advocacy is one of the things we do. We should be meeting some of the people who make some of this decision. We have sent in this thing letters, hoping they will call us soon. We like in Mahama Care like this, it's one of the areas that we need to provide treatment for our asthma patients. We need to provide them with medication. If at a very good cost. And also if you are going to train specialists, which is part of this Mahama Care thing, they should be able to train pharmacists, nurses, and physicians to specialize in asthma care. And they should be able to make sure that those drugs are readily available for them to use. So the government has a role to play, and we as citizens also have a role to play. We believe that we are in between there, between the patients who have no voice and everything. We are their voice to the government, and we are hoping that we get some good response for them.
Dr. Victor Wutor. And if you want to know his credentials, go to the beginning of the show. Because that's another 5 minutes of us staying here. Doc, thank you very, very, very much. As I said, we'll be catching up with you again to pick up where we're leaving off today. And we'll be also keeping our eyes on the activities of Asthma Ghana. Please join Asthma. And we spelled Asthma wrong. Guys, come on. One moment. Let's do this.
Right that's I didn't even see that. I
just noticed that from the money that I didn't even see it from here.
It's my pleasure. Any day, I'm more than happy to talk about asthma. And look, you're doing a good job, to my brother. You're doing a good job.
Thank you very much. Thank you so much. And so, like I said, if you want to join that platform, I would definitely recommend joining the WhatsApp group, Asthma Ghana, on 2+233, that is 05 plus 233. There will be no zero. Guys, come on, look sharp. I know it is like spur of the moment. 233 54 62 No, 682. Me and Kazasume de Remy who are how 233-54-682-9126 and join the platform Asthma Ghana. It's a wide network of patients, pharmacists, doctors, researchers, whole group of it's a support group, serious support group. And while we're at it now, if you know somebody who's suffering from asthma, invite them to that platform, please. Even if you are not suffering from asthma and you know someone who is suffering from asthma, tell them you know where they can find quality help. Yes. While you are at it now, I don't think that you'll be on that platform and then doc will take the aerospace thing and go and give it to somebody else somewhere. I'm sure you can get one of those things, right? So if not for anything at all. But yes, I would definitely recommend joining Asthma Ghana. Dr. Victor Wutor, thank you very much for your time again.
Thank you so very much. And thank you so much to your listeners as well. You have a good one.
And you too, sir. Thank you very much for all you do.
Radio, culture.